every now and then somebody develops varicose veins as a symptom or manifestation of something that's a little bit more important.
Welcome to Baptist HealthTalk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Sandra Peebles. Welcome back to a new episode of Baptist HealthTalk, where we answer your most searched questions on trending topics. Today, we're talking about one of the most misunderstood health issues out there, varicose veins. You've probably heard all the myths. Only women get them. Crossing your legs causes them, and they're a cosmetic nuisance. But the truth is far more interesting and sometimes more serious than most people realize. To help us separate fact from fiction, we're joined by Dr. Ian Del Conde, cardiologist and vascular medicine specialist at Baptist Health Miami Cardiac and Vascular Institute. Thank you so much for joining us.
Thank you, Sandra. Thank you for having me.
So let's start off with the most basic question. What are varicose veins, and do they only appear on the legs?
Great question. Varicose veins are nothing other than just visible veins. And although they can appear anywhere in the body, they typically appear in the legs because this is where veins are with highest pressure and the veins just dilate and become more visible.
So that's what it is. They're just dilated veins, the same as, say, a spider vein, just larger.
Exactly. There are many different types of veins in the body. So spider veins are in one spectrum, and varicose veins are much larger and visible.
There's a common myth out there that only women get varicose veins. Is that true?
Absolutely false.
Really?
Anyone can get varicose veins, but it is true that women are at increased risk. And it is believed that this is partly due to estrogen. And also women who become pregnant and have a baby, they're at increased risk of developing even larger varicose veins.
Is that because of the weight?
Well, let's think about the way that blood flows in the body. So you have the heart that pumps blood to all of the body, but then that same blood has to go back to the heart, and it travels back to the heart through the veins. So in your legs, blood should always be flowing up towards the heart. So blood flows against gravity. If there's anything that's obstructing or making that flow difficult, such as having a baby, increased weight in your abdomen, there's going to be congestion in those veins. They're going to dilate because veins are very elastic. They're like balloons. They're going to blow up. They become visible, and that's what a varicose vein is.
So they really have to do a lot of work.
They do.
Trying to get that blood back up to the heart. Another very common myth is that varicose veins happen because we cross our legs. Is that true or false?
Absolutely not.
No.
Varicose veins happen, number one, we're on our feet all our lives. So just by gravity and by physics, blood is going to tend to pull in the legs, and that's where veins will become dilated. So the longer you live, the longer you're exposed to that high pressure. But crossing your legs momentarily will not cause any varicose veins to appear.
How about crossing your legs all day?
It shouldn't.
It shouldn't. A lot of people think that varicose veins are just a cosmetic issue, but is there really an underlying medical issue? Is there a cause to worry?
Well, let's go back to what a varicose vein is and what it could signify. So varicose veins, as I said, are just dilated veins. So a big important question to answer is, why has somebody developed varicose veins? Most of the time, it is nothing worrisome or important. But every now and then, somebody develops varicose veins as a symptom or manifestation of something that's a little bit more important. So for example, if someone has never had varicose veins, but suddenly they develop varicose veins in just one leg, for example, then you need to look for an anatomical reason why those veins have developed just in one leg. You want to look for obstruction and other things.
What kind of obstruction are we talking about?
Anything that is compressing the veins in the pelvis. It could be, for example, in a woman, it could be a fibroid in the uterus or anything else that is compressing a vein.
And one wouldn't relate a fibroid in the uterus to varicose veins, and yet look.
Exactly. But the vast majority of varicose veins are not dangerous. And back to your question, whether they're cosmetic or not, the majority of varicose veins are indeed a cosmetic issue that poses no risk or jeopardizes the health of the person.
Is this an issue of middle-aged people, or can people in their 20s get varicose veins?
Varicose veins tend to appear and worsen with life. So as time goes on, they get a little bit more prominent. Having said that, there are young people that develop varicose veins. This has some genetic components. Varicose veins, like many other conditions that afflict humans, also cluster in families. So there is a genetic component. But certainly young people, healthy, can develop varicose veins for sure.
What's the difference between varicose veins and spider veins? And are spider veins varicose veins in the making?
Right. Great question. So think of veins as if they were branches in a tree. Like you have a tree, we have a big tree trunk that then divides into the main branches, then again divides and divides and divides until you get the twigs. So a similar situation happens with veins. You have large veins, but those veins can split until you have the little twigs. Those are the spider veins. So the spider veins are, if you will, like a varicose vein of the tiniest veins in our body. They're typically just under the skin. They're visible and almost always are purely a cosmetic issue.
What about if the vein hurts?
Number one, it is unusual for veins to hurt, but they can bother. They can bother, they can itch, they can throb a little bit, but significant pain is usually not a symptom. If they hurt, if they bother, then we tend to treat them as opposed to just watch them.
Earlier, you mentioned family history. Talk to me about genetics and how does that play out in families as opposed to other, let's say, cardiac issues. Is it a hereditary condition?
Well, it's hereditary in the sense that genes do play a role in whether someone will or will not develop varicose veins. But it's not one of those conditions where if your mom had it or your dad had it, for sure you will have it. It's not a genetic disease in that sense. But yes, it does tend to cluster in families like many other things, like diabetes and hypertension and so on and so forth.
Sure, just like eye color and everything else.
Exactly.
So it's always something to look out for. What about lifestyle habits? Are there things that we can do that would worsen it or improve varicose veins, a likelihood of developing them?
Yeah, definitely. So excess weight, well known to predispose to the development of venous insufficiency and varicose veins. So that's yet another reason to be at your ideal weight. And then there are some people, doctors included, but many other professions, that you spend prolonged hours during the day, every day, standing. So this just favors the dilatation, the enlargement of the veins in the legs, leading to varicose veins. So surgeons, police officers, hairstylists, teachers, they're common professions linked to varicose veins.
We spoke about pregnancy, but let's say postpartum. So a woman is pregnant, she's carrying a baby, develops the varicose veins, but then delivers the child, so now the weight comes off. In that period, is it possible for the veins to disappear, or what happens?
They typically improve, but they may not completely disappear because the vein has dilated and it may not return to exactly where it was before pregnancy.
And if someone has varicose veins and just leaves them alone, what happens? Is that okay?
Absolutely nothing. That's the majority of the individuals in this planet will develop varicose veins. It's, again, very common, and most people will not need any sort of intervention for this. And the natural history of these varicose veins is that they will remain, for the most part, pretty stable throughout life and not be a risk to anything.
That might be the answer to my next question, but I'm going to ask because we here play the most searched questions. So if people want to know, I want to make sure to ask you this way. Sometimes varicose veins can be unsightly and even scary to look at. They look maybe like they could burst. Can that happen?
Yes, it can. Oh. It's not common, but yes, it can.
So it can happen.
So there are many.
I thought you were definitely going to tell me no.
No, they can. They can. But again, there are different veins, so different sizes of varicose veins. And the ones that can rupture are typically not the big ones, like the very large varicose veins that you see. The reason those don't rupture is because they're typically varicose veins of medium-sized veins that are a little bit deeper in the skin. They don't rupture. They have enough support by surrounding tissues. The ones that can rupture are the ones that are very, very superficial, like spider veins. Like, let's just call them the older brother of spider veins. They're very superficial. They tend to appear around the ankles or the lowest part of the legs. And you're prone to injury. You're walking, you're wearing shorts, not long pants or whatever, and then you scrape your skin, normally nothing would happen. But these varicose veins are so superficial that they do start bleeding. Now, are you going to die from this? Absolutely not. But there will be blood. People do get scared. It becomes a bit of a mess. What I always tell patients is, if this were to happen, put direct pressure, it will stop bleeding. And you don't need a lot of pressure to compress a vein.
So it's not really something that they're just going to burst on their own. There has to be some sort of
There is usually trauma. Yes, trauma. Dogs. That's something that I see very often. Like a dog jumps or scratches.
And that can happen. Very common, of course.
Easily.
Can varicose veins lead to other issues like dementia, other health risks?
Absolutely not. There is no link between varicose veins and dementia or stroke or heart conditions. I know this is an important question because many patients ask this, and it's a legitimate concern, but the answer is no.
And that's what we want to do. We want to clear up any confusion people might have. It's such an incredible opportunity to have you here and be able to ask you all these questions openly. Right. Even if I feel some of them are redundant or might sound a little silly, I prefer to ask than not ask and leave the person with the doubt. So here goes another great one that I couldn't wait to get to. And that is, if you have varicose veins, do you have to live with them forever, or is there treatment?
There are treatments for varicose veins. There are many treatments for varicose veins. Some of them involve, for example, the injection of different solutions to sort of chemically burn the vein and make it go away. Sometimes we use catheter procedures to also make them go away. But only a small number of patients with varicose veins will need any of these procedures. Varicose veins are very common. It is estimated that up to 40 to 50% of individuals in this planet will develop some form of venous insufficiency, typically varicose veins, but the vast majority of them will live their lives very well and in good health without needing any of these interventions.
So would there ever be a case, I know you mentioned some of the methods, I don't know if there are others that you'd like to add, but is there ever a case where you like burn a vein or cut a vein off, or would that never be a possibility?
There are. But typically not for varicose veins. So varicose veins are part of a spectrum of something called venous insufficiency, which is basically veins not working properly and venous blood starts pooling in the legs. One manifestation of venous insufficiency are varicose veins. There are other manifestations of venous insufficiency. We use those procedures such as cauterizing, it's called an ablation, cauterizing the vein from the inside, ablating the vein. We do that in more advanced cases of venous insufficiency. It is not usually recommended just for cosmetic purposes. But yes, it can be done, and it is done every now and then in well-selected patients. And
in the case that someone would need to have that type of treatment, how long is the recovery?
Oh, it's very quick. It's a minimally invasive procedure, typically done in the office setting. It takes about 30 minutes. I've had patients who've had the procedure and immediately afterwards go back to work. So the recovery is very, very quick and easy.
And ultimately, the question that we all want, because we all want to take action to do things to improve our health, is there anything that people can do right now to protect their venous health and to hopefully prevent varicose veins?
Physical activity, stay at your ideal weight.
That's
simple. Those are the main things. Yes. Those are the main things that people can do.
And when we say physical activity, it doesn't have to be high impact or high level cardiovascular. It's walking.
Walking, get your 10,000 steps a day in.
So even doing things around the house or yard work 100%, is movement.
Yes.
This has been a fascinating conversation. Thank you so much.
My pleasure.
Dr. Conde, it's really been amazing. I hope you had as good a time as I did. I promised you that it would be fun. I hope it was as fun for you as it was for me.
Thank you, Sandra.
I think that our audience definitely enjoyed it. Thank you again for sharing your insight with our audience. And remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.